Well, now that golf season is in full swing, that means there could be an increased risk for injury stemming from your golf game. And to talk more about that, we are joined now by Dr. Adam Ferguson, who's a surgeon specializing in foot and ankle injuries from Comprehensive Orthopedics. Dr. Ferguson, thank you so much for joining us this morning.
Angelo, thanks for having me.
Of course. So I got to imagine with all these people out playing golf, you're definitely seeing some more injuries. Can you just tell us about what are the common injuries you guys are seeing right now?
Yeah, absolutely. I mean, obviously, golf is one of the socially distancing sports that's pretty reasonable and acceptable. You know, personally, right now, the most common issues usually involve the lower back, some occasional sprains in the wrist. I actually saw a gentleman the other day who partially tore his Achilles tendon. But usually a lot of extremity and low back stuff seems to be the common theme amongst the golf-related injuries.
And you talked about those areas, so I know a lot of us probably don't like stretching or warming up, but is that something we can do to prevent those injuries? What are things we can do at home to prevent all that?
Absolutely. I mean, golf is an athletic endeavor, and just like anything else, it's always a great idea to warm up. So, you know, it's never great to show up 5 minutes before your tee time and go try to crush the ball off the first tee. Hit some balls off the practice tee, practice putting, practice chipping. We actually have on our website a link to some stretches that are golf specific that we put together. If you go to comprehensiveorthopedics.com, there's a link right on the homepage there about halfway down. You can click on it. It'll take you to some YouTube videos that are specific for golf and golf-related potential problems.
Awesome, very helpful. And in the case that people do get injured while playing golf, what sort of treatment do you recommend there?
Well, so usually it happens in the middle of a round. If you feel like it's not severe enough that it's going to prevent you from continuing, you can try. If it is something that's bad enough that maybe you have to call it early, that's never a bad idea. Conservative treatment is always the first step, whether you come and see me or just on your own. So that's things like ice, elevation if it's an extremity. If you're medically able to, taking over-the-counter anti-inflammatories like Aleve or ibuprofen can also be quite helpful. And then ultimately, you know, if it's something that doesn't get better in a matter of days or, you know, a week, then it's not a bad idea to go see a orthopedic provider or your primary care physician.
Yeah, and Comprehensive has a pretty extensive conditioning program. Can you talk to us more about that?
Yeah, absolutely. So, you know, in addition to seeing patients in the office for these type of acute problems, we also do offer a golf-specific evaluation and treatment program. It's put on by our physical therapy department. Basically, what happens is the patient comes in and gets their own unique swing evaluated. You know, we do a swing analysis and breakdown and look for areas that, you know, maybe you're tight, maybe you could use some strengthening. A lot of the golf swing basically utilizes a lot of the joints in the body, so there's a lot of potential areas for concern or problem. So once the swing's been evaluated and we've seen you, we develop a unique treatment plan to work on strengthening, work on mobility, and both increase accuracy and distance as well as decreasing your chance for potential injuries.
Good information. All right, Dr. Adam Ferguson, thank you so much for joining us this morning.
Absolutely. Thanks again for having me, Angela. I appreciate it.
Of course. Have a great day, man.